Okay, then we have here the specimen integrity. So, again, when you are collecting the specimen and analyzing that one in the urinalysis laboratory, you need to deliver the specimen to the laboratory within 2 hours within the 2 hours of collection process. If not, you need to eventually preserve the specimen. So the following here, we're going to happen both in the biochemical and chemical constituents of your urine here when the specimen was not able to properly preserve. The first one, for the color. The color here of the unpreserved specimen will try to darken, so magiging dark yellow ito because of exposure to the air. Another one, clarity. So nagiging turbid ang ating specimen as it's not able to be delivered to laboratory or the specimen has been long-standing because again of the bacterial multiplication. So pag dumadaming bacteria, nagiging cloudy ang ating specimen. For the odor, your odor here become ammoniacal. So the normal odor of the urine is aromatic. However, once the urine has been already with the bacteria multiplied on that, the urea in the urine will be broken down by your bacteria to your carbon dioxide and ammonia. Therefore, magiging ammoniacal ang urine odor natin. Then we have the pH. So because of the increased breakdown of the urea because of bacterial degradation, your ammonia is, of course, that one is an alkaline na pH. Therefore, it would increase your pH. Another one, your glucose here. So glucose will be decreased because of the glycolysis. Ketone bodies. These are volatile substances and therefore they will be lost here once your specimen has been exposed to the air for so long period of time. Then we have here the bilirubin. Bilirubin will eventually decrease because your bilirubin is a photosensitive na pigment. So once exposed to the light, your bilirubin will be converted to another pigment, biliverdin. So wala ka ng bilirubin, but what you have is already the biliverdin. Urobilinogen, on the other hand, is another pigment that eventually will be oxidized. That will be converted to another pigment from the urobilinogen magiging urobilin. So therefore, hindi na siya urobilinogen. Therefore, decreasing the level of this. Nitrite is correlated. This is nitrite here is a test for your bacteria. So since dumadaming bacteria, expect this nitrite to be increased for that. Your WBC and RBCs, it would eventually try to destroy the cellular structure of your RBC and WBC. And therefore, wala ka nang makikita pag sobrang tagal na ng ating specimen na hindi siya na-preserve. And bacteria, so of course, ito may kasalanan ng lahat ng changes. So that will be responsible here for, that would increase because of the bacterial multiplication since hindi siya naka-preserve ang specimen natin. That's why we need to deliver the specimen within 2 hours of collection process. Again, pag hindi siya na-deliver ang specimen within 2 hours of collection process, then you need to reject the specimen. Okay, so tanungin mo, pag nag-deliver ang patient ng specimen, kailan siya na-collect. If that one is more than 2 hours, then you instruct the patient to recollect the specimen. Okay, now we have here the different chemical preservatives na pwede mong i-add sa ating urine. But walang perfect na chemical preservative dito. Meron silang positive or advantages, meron silang disadvantages. Okay, so most likely dapat ang ating chemical preservative here should be bactericidal to prevent here bacterial multiplication. So we have here, pinaka the best, I think here will be the refrigeration. So the best and the easiest way of the preservation will be the refrigeration. The problem with the refrigeration here would able to preserve your dissolved substances or sediment in your urine. However, ang drawback ng ating refrigeration, it try to precipitate your crystals. It try to precipitate here specifically your amorphous substances. So we have your amorphous urate and we have your amorphous phosphate. Amorphous urate will have here produces a pink na sediment, whereas the amorphous phosphate will be producing here a white precipitate. Amorphous urate pag ang pH mo ay acidic, amorphous phosphate pag ang pH natin ng urine natin ay alkaline. Again, these amorphous substances are precipitated only because of as a product of your refrigeration process. Another one, we have here your thymol. Thymol here preserve your glucose well, pero it will interfere with the acid precipitation test for your protein termination. So kung you wanted to measure the protein concentration using this method, it will interfere with the result. Boric acid, on the other hand, able to preserve the proteins. However, the problem with the boric acid, it try to precipitate large amount of the crystals. And pag madaming mga crystals, for example here, it try to obscure your microscopic identification. So, sobrang dami ng background mo under the microscope, so mahirapan ka mag-identify. Next, we have here the formaldehyde. Formaldehyde able to preserve your cellular sediments well, or your cells here. The problem with the formaldehyde, formalin is an oxidizing agent. May mga test tayo sa reagent strip, yung strip na ginagamit natin. Ang test principle niya is more of the reduction, oxidation reduction. Since oxidation ito, it will interfere with the test results. Example of the tests in your reagent strip na test pad, we try to utilize that one are the following. We have here the glucose, test for the glucose, test for the blood, test for the leukocyte esterase, and the copper reduction test. All of this one will be affected if your specimen has been added by your formaldehyde. Okay, then we have here other chemical preservatives. So we have your toluene. Toluene here, excellent. It try to do not interfere with your routine tests. However, the disadvantage of your toluene, that one would able to float on the surface of your urine, so parang siyang messy. And at the same time, it try to cling on your pipettes. Sodium fluoride is an excellent preservative for the preservation of your glucose to prevent the glycolysis. It's also for your drug test analysis. But the sodium fluoride, again, just like your formaldehyde, also try to interfere with the chemical tests using your agent test pads, especially for the test for your glucose, for your blood, and even for your leukocytes. Phenol, on the other hand, is also an excellent preservative, only that it tries to cause your odor change. And Sacomano preservative is for use here for cytologic analysis for your histopath and many others. Okay, now we go to the different specimen collection procedure. So the first one we have here, the random specimen. Random specimen is the urine specimen collected any time of the day. However, the problem of the random specimen is that one is more of the diluted specimen, although you can use that one for the routine tests. But then again, since that one is a diluted specimen, it might underestimate the actual concentration of your cellular sediments. Next, we have here the first morning urine. So the first morning urine is the first voided urine after the patient arises or immediately after the patient arises from sleep. Since this one is the first morning urine, the urine has already stayed in the bladder approximately 6 hours, 6 to 8 hours, the time of your sleep. Ganun siya. So, therefore, your first morning urine is considered to be a concentrated specimen. So, this is the most ideal here when we are doing the routine tests and also for your pregnancy tests. Another one, we have here the fasting na specimen. Fasting specimen is the second voided na urine. So, mean to say, the first, like, after you have arisen from sleep, the first voided urine become your first morning urine. And the second voided urine, that become your fasting specimen. And at the same time, this is being collected, the patient is still on the fasting state, dapat hindi pa siya kumain. So this is specimen for the glucose termination for the patients to monitor here for the possible diabetes mellitus. 2-hour postprandial glucose specimen here is a specimen collected 2 hours after a meal. So mean to say kakain siya, then after 2 hours, you collect the specimen. It's based on the principle na after 2 hours, parang glucose level natin is equivalent to your fasting state. So 2 hours postprandial, primarily, is also for the glucose testing for monitoring patients on the insulin therapy. Okay, the next one we have here the glucose tolerance specimen. So the glucose tolerance specimen is a time, this is actually your specimen collected at a different time interval. So it depends on the policy of your laboratory. So pwede tawag tayong oral glucose tolerance test where you give parang orange juice to the patient. Papainumin mo yung orange juice and try to collect the blood here at different time interval. So you could have here the interval of fasting. So like if the patient go to the laboratory, still on the fasting state, kukuha na mo muna ng blood, saka ng urine. And after that one, papainumin mo siya ng glucose load in the form of your pang orange juice. Then after 1 hour, niya makonsume, kukuha na mo ulit siya ng blood plus the urine. And after 2 hours, 3 hours. So, ganun siya kadami nakukuha na ng blood. So, this would help you then to assess really here if the patient is diabetic or not. So, your glucose tolerance specimen here, you are collecting here both the urine and the blood of the patient. So, this is done here primarily for glucose testing plus the ketone bodies testing. Then we have here the 24-hour urine or your time specimen. This is basically for those analytes which are irregularly passed in the urine sample. So, may mga specimen kasi tayo or may mga analytes wherein they are highest during the morning. Ang kanilang level in the afternoon is much lower compared during the morning. To provide a greater assessment of the entire concentration of that, so you collect that one in 24-hour time na lang. Okay, so again, this is for the specimen would have here the urinal variation of the excretion of that or being released in the urine. It's also basically for quantitative determination of your analytes. So it's very specific here. So it's being done for the following analytes. For your electrolytes, for your 17-hydroxy corticosteroids, and we have also here your hydroxy, ketosteroids, corticosteroids. We have also here your catecholamines. And even our creatinine clearance test specimen is also being collected in 24 hours. So as what we have discussed before, when you're collecting the specimen for 24 hours, the first voided urine is being discarded and try to collect the second urine up to the time 24-hour time to when you start your time of your collection or the first time you try to collect the specimen or the first time the patient voided the urine. And make sure that the specimen is all the specimen being collected and every time the patient try to urinate, put that one in a container and preserve that one in the refrigerator. Then after 24-hour time, try to measure the entire volume, try to mix the specimen and just get an adequate portion of that become your representative sample for that. Okay, then we have also here the catheterized specimen. So catheterized specimen is a specimen collected primarily for your bacterial culture. So this being done here by inserting a catheter to the urethra, to the bladder of the patient. So, medyo traumatic itong procedure na to. And therefore, this one would provide a reflection of the urine specimen or reflection of your bladder. So, pag i-culture mo ito, pag madaming bacteria, makikita sa specimen to say may bacterial infection in your bladder. That would signify urinary tract infection. Your midstream clean catch, on the other hand, is less traumatic compared with your catheterized specimen. This is also used for bacterial culture because one would have less contamination. Okay, so your midstream clean catch is being done here by, okay, the first voided, so ihi ang patient, the first portion or the first part of the urine is being discarded. Do not collect that one. Then you collect the middle portion, kaya nga midstream clean catch. And if you are about to end in the urination, you try to end up urination here in the toilet bowl. Okay, and then once you are collecting, when you are doing the midstream clean catch, first you need to clean your um, sexual organ. For the male, then you need to retract the glands and try to wipe that one. And for the female, you need to retract and wipe the labia, then wipe the labia in order for that not to be contaminating your urine collection. Since you're collecting the middle portion, this also would have your less contamination of your cellular structure here, like your, for example, your squamous epithelial cells. So this would have the same quality of the specimen as with your catheterized specimen, making this one is less traumatic. Another one, we have here your suprapubic aspiration. So this one is being done here by inserting a needle here to the abdomen of the patient up to the urethra. So medyo traumatic din ito. This would also allow here for testing the urine for bacterial culture and also for cytologic examination. Another specimen we have here, the specimen for evaluation of your prostate infection for the males. Okay, so again, pwede ka magkaroon ng infection na prostate. It's different from the infection with your bladder, urethra. So, both of that, however, here would be characterized by an increase in WBC count and your bacteria. But then we need to differentiate kung saan ang galing ang ating bacteria. Is that from your prostate ba or from the urethra of the patient? That's why we have here the different method for your prostatitis examination. The first one, we have here the 3-glass technique. In the 3-glass technique, you're going to prepare 3 glass or 3 tubes. The first tube, you need to fill this one with the first voided na urine. So, umihi siya, the first portion of that, become the content of your tube number 1. Then, the middle portion become your clean catch, your midstream clean catch, become here the content of the second tube. Then, you try to massage the prostate of the patient. So, ang gagawa nun ay physician. So, medyo traumatic. Hindi massage mo ang prostate. A physician will going to do that one. Okay, then after that one, so after you try to massage the prostate of the patient, we are expecting that magkakaroon ng secretion coming from the prostate. And that become here the specimen for your tube number 3. Then after that one, you try to culture the 3 tubes. Okay, the tube number 2 serve here as our control. Okay, paano siya magiging control? Pag ang result ni midstream clean catch natin, for example, is positive. Pag sabing positive, madaming WBC, madaming bacteria. Ano magiging implication nun? Magiging invalid ang ating procedure. Bakit magiging invalid? Kasi hindi natin malalaman ngayon kung saan galing ang bacteria or your WBC. Is that in your bladder or is that in your prostate? Kasi pag nag-secrete ng secretion coming from the prostate, dadaan pa din siya sa ating bladder. In your bladder, urethra. So kung positive na ito, hindi mo ngayon malalaman kung saan ang infection galing. So dapat hindi ito positive ang second tube natin. For us then to differentiate where is the origin of the WBC or even your pus cells natin or even your bacteria. How would we know that the patient would have here the prostate infection? So try to culture the 3 tubes. Then if, for example, your tube number 3, again, your tube number 3 again represents here the secretion coming from your prostate. If the WBC count of that is more than 10 per HPF, or the bacterial count is more than 10 times compared to your tube number 1, which is reflection of your specimen coming from your bladder, so it would signify that the patient would have the prostate infection. Okay, another modification of your prostatitis specimen collection, we have here the 4-glass collection, also called here as your stamimers. So we have here the 4-glass collection method here. So the first tube is your VB1. This represent here the first voided na urine. The VB2 here represent the specimen collected during the midstream clean catch. And we have the EPS or express massage, prostate massage specimen. So this is being collected while the patient is the prostate of the patient is being massaged. And we have also here the VB3 is a specimen collected after the massage, a prostate massage. Tube number 1, your VB1 or your VB2 represent here the specimen for your bladder infection. And your APS and VB3 represent here the specimen for your prostate, from your prostate. So prostate infection established here if your tube number 3 and tube number 4 here would have a WBC count of 10 to 20 per HPF. So that's high pus cells or madaming nana. It will signify here the patient would have a prostate infection. Another one, we have your pre and post massage tests. So you're going to collect here the specimen pre-massage. So the tube number 1 is being collected here as a midstream clean catch. And your post-massage, so before you try to collect the second tube, massage the prostate, then try to collect the specimen after you perform here the prostate massage. And that become your tube number 2. For the diagnosis of a prostate infection, your tube number 2 here should at least 10 times higher bacterial count compared to your tube number 1. Because again, your tube number 2 represents your specimen, the prostate. So pag madaming bacteria, 10 times more than the bacterial count of your tube number 1, which represent the specimen in your bladder, so that would signify a prostate infection. Okay, then we have here the specimen for your pediatric specimen. So this is a very challenging collection method for the baby because of course here mahirap sila mag-collect ng specimen. So most likely what we are giving the baby here would be the adhesive plastic bag or the wee bag na tinatawag, or try to put that one sa kanyang sex organ in order for that to collect the specimen. So medyo mahirap ito pag babae because greater tendency na makontaminate ng fecal sample ng patient natin. Then we have here the test, the specimen here for your drug test. The specimen for the drug testing withstand here a legal implication. So in the laboratory, you need to be very careful here, and you need to make sure that the one in the name of your list, in the name, in your name here, I mean the one undergoing the drug testing here is really the one who collect the specimen. So most likely collection of specimen for the drug test being done in the laboratory itself, you should have a separate room for collection of the specimen. And make sure here that, okay, you need to monitor here the entire collection of the specimen. Make sure here that the specimen has not been tampered or contaminated by the patient. So most likely, ang urinal na ginagamit for drug testing is the waterless na urinal. Kasi of course here, if you try, baka i-dilute ni patient ng water from the faucet ang kanyang specimen, it might result here to the false negative results. Okay, one way of checking here if the specimen has not been tampered here would be checking the temperature of the specimen. So, random specimen would have a temperature between 32.5 to 37.7 degrees Celsius. Pag tinamper niya ito, like try to dilute that one, then ang specimen temperature bababa. So, again, you need to be very careful for that kasi pag positive ang patient, di ba? So, ano implication ito? Drug addict ang patient, may legal implication ito. Okay, so thank you.